internal medicine. All right. So you are to do a lumbar puncture, okay, like we did in the first question when we talk about what the meningitis, isn't it? So you have to do a lumbar puncture on a man who is suspected to have meningitis. Now you see. Now lumbar punctures have both diagnostic and therapeutic indication. Of course, it has both diagnostic and therapeutic indication. What I mean by diagnostic is it is used to diagnose. Just like in the case of meningitis, you want to diagnose, you want to make a diagnosis. So you have to use it so you can tell if there's something in the CSF or the cerebrospinal fluid, to check if there's blood, to check if there's increase in cells. That is more or less like what? Diagnostic. Then therapeutic is like you are using as a procedure to give medication or for treatment. So that is what we are going to be discussing right now. So lumbar puncture has both diagnostic and therapeutic indications. So let's look at the question that follows. Now, list 3 diagnostic indications. 3 diagnoses. That means on what condition are we going to use lumbar puncture as or for diagnostic purposes? For diagnostic purposes. So over here, what can you be looking out for? If the person is having what? Neck stiffness or signs and symptoms of meningism, you might want to use lumbar puncture as a diagnostic indicator. Because neck stiffness could be meningitis, encephalitis, isn't it? Now you can also talk about altered consciousness. Altered consciousness. For example, in the case of subarachnoid hemorrhage, somebody could lose consciousness. And you have to do what? Lumbar puncture to make sure that there's no blood in the CSF. If there's blood in the CSF, that could confirm that this person is having what? Subarachnoid hemorrhage. Then when you're having an unexplained fever, or fever of no origin, you might want to consider doing a lumbar puncture. Then, of course, unexplained seizures or unexplained convulsion, you might want to consider doing a lumbar puncture as well. So again, signs of what? Meningism, you have to do lumbar puncture. Altered consciousness, unexplained fever, unexplained seizure, unexplained convulsion. They are all the same. So these are the things that perhaps we can use lumbar puncture for. Now, list 3 therapeutic indications. So what do we use it for? What kind of medication do we use it for? So basically, we use it in a spinal anesthesia. Spinal anesthesia, that is injection of a local anesthetic or an opioid into the subarachnoid space. So basically, spinal anesthesia. Then you can also give it for intrathecal administration of chemotherapy. Intrathecal administration of chemotherapy. That's like an injection into the spinal canal or into the subarachnoid space for chemotherapy. All right. We're going to talk about intrathecal administration of antibiotics. Antibiotics. Again, there's an injection into the spinal canal. So you're injecting antibiotics into the spinal canal or into the subarachnoid space. Then last but not the least, you can talk of injection of contrast media for myelography or for cysternography. Injection of contrast media for myelography or for cysternography. So these are some of the therapeutic indications or medicinal uses for lumbar puncture. Again, spinal anesthesia, intrathecal administration of chemotherapy, intrathecal administration of antibiotics, injection of contrast media. So these are the therapeutic indicators or indications. What are the contraindications? In other words, under what condition are you not going to do lumbar puncture? Under what conditions? 1, when there is an infection at the lumbar puncture site. So you want to do a lumbar puncture, usually around the L3 and the L4, the space between the L3 and the L4. That is where we do the lumbar puncture. Okay. So now if there is any source of infection or there is sort of infection around that area, it is contraindicated for you to do lumbar puncture. Then when you are suspecting an increase in intracranial pressure, you are suspecting an increased intracranial pressure, don't do lumbar puncture. Then in cases of severe thrombocytopenia, don't do it. Then when you're also suspecting cord compression, these things you wouldn't do lumbar puncture. Again, infections at the lumbar puncture site, suspected cases of raised intracranial pressure, severe thrombocytopenia, suspected cord compression. So these are the contraindicators. What are the complications of the procedure? So now we are not talking about contraindications. We are looking out for what? Complications. So you are finished doing lumbar puncture. What can it lead to? What are some of the consequences we can find? The complication. One, you can talk about the post-lumbar puncture headache. So sometimes when you finish lumbar puncture, you will have what? Headache. You can talk about infection. You can talk of bleeding. You can talk of cerebral herniation. Then you can even be considering some minor neurologic symptoms. Basically, you can be looking at some of these things as the possible complications of the procedure. All right. So again, headache, infection, bleeding, cerebral herniation, and minor neurologic symptoms. All right.